chat today and get some of those questions answered for you all. I have Dr. House with me here, and Dr. House, would you like to give us a little bit of your background?
Sure. My background is actually, before I became a holistic doctor, I worked for an environmental health and nutrition company, and we sold air filtration, water filtration, we sold herbs and homeopathy products, plus we did all natural hair care, skin care, body care. It was kind of like the environmental Walmart of the future. And it was making a big difference, but I thought I could make a bigger difference if I became a holistic doctor, because I saw that's where the trend was going to, because people were getting sick of what the results they were getting from our traditional Western medicine here. So I went back to medical school for 4 years. I actually did a semester in the Far East where I learned a procedure called biopuncture and prolopuncture, which we'll be talking about prolopuncture today. And I've used that over the last 20 years, and I've helped thousands of people from not having to get surgery or joint replacements. And it's incredible. In fact, I actually fixed myself with it, so I'm a true believer in it, and that's why I can go out with confidence and tell people this is the way to go.
Awesome. Okay, let's jump right in. What is prolopuncture?
All right, so prolo actually means prolification. It means like cells adding or building of cells. And the reason it's puncture is because we put the injection of, it's actually got B12 in it, that helps with the healing process, and it has dextrose in it, and we put those in the acupuncture spots. And the dextrose is sugar. A lot of probably people have heard of dextrose. We use actually 50% dextrose, and what it does is it's a scarring agent, and I'll explain about that more here in a minute.
Okay. What type of injuries would we be using prolopuncture for? What is it helping?
Prolo is incredible for joints. So hip joints, knee joints, shoulders. If you have torn rotator cuff, if you have a torn labrum, either in your hip or in your shoulder, or if they're degenerative, we can help with that. In your knee, it helps with torn meniscus, degenerative meniscus, partially torn ligaments, partially torn tendons, and a lot of times, doctors would tell you your joint is bone on bone, and there's actually no way it would be bone on bone, because when the two bones touch each other, what happens is you'll get like a catching, or people say it's grabbing or giving out. And if it was completely bone on bone, you wouldn't be able to perform. It's just a small area has a little bit of bone on bone, and when you move a certain way, the bones will touch, and then it'll get that grabbing or catching. But when doctors say, oh yeah, your joint's bone on bone, in our mind we think it's whole bone on bone, but it actually isn't. And x-rays just don't show what we're looking for. A lot of people will go and get an x-ray, and they'll say the doctor said they had torn meniscus or torn labrum, and it only shows bones on x-rays. So an MRI is needed, because that shows everything, and it actually tells me where we need to put the Prolo shots. And we do MRIs. We have a special that we can get really inexpensive MRIs from a company locally here. And when you come in, we can talk about that.
And I know you have an interesting story. Can you tell us how you got started in this procedure?
Yes, about 25 years ago, I was skiing and I tore my ACL, and I had a well-renowned doctor here in Sarasota. He does a lot of the professional athletes when they come down for spring training, and a lot of teams have their rehab here, so he's done thousands of knees, and he was a good friend of mine. And so he did the procedure, and they actually take either cadaver tendon or your own tendon. He took my own tendon and he screwed it in, and then it takes 6 months for that dead piece of meat to turn back into a ligament. And now during those 6 months, you can't do anything, because if you stretch that dead piece of meat out, then you'll have play in your joints. So after the 6 months, I started to do some rehab, and I literally couldn't walk up and down stairs without my knee totally blowing up. So I went back to him, and I'm like, what did you do to my knee? It's worse than it was prior to surgery. He goes, well, we fixed your ACL, but you also had a torn meniscus, so I did you a favor and I cleaned it. I'm like, what do you mean you cleaned it? And he explained to me, like, soft tissue in your joints, when they tear, they never mend themselves. When you cut yourself, you get fibrous tissue that builds up and that mends the tear. Well, that won't happen in our joints. And so what happens is it just tears more. And so they don't want it to tear completely apart, because then, the bones will touch. So they go in there and they cut the tear out so it doesn't tear anymore. And they say it's kind of like an old sewing technique. And so when he said that, I looked at him, I'm like, what do you mean? Isn't that kind of like cutting cushion out of a couch? And he's like, well, Dr. House, I've never heard anyone put it that way, but that's exactly what it is. And I'm like, oh my gosh. And of course the next question was, why would you do that? And he goes, that's procedure. In other words, that's what he was taught. And so I asked him, I was like, you've done thousands of knees. Have you ever had knee surgery? He's like, no. I'm like, well, from one doctor to the next, it doesn't work. And see, the thing is most doctors in their specialty, they usually don't get hurt or don't have the diseases that they're treating. So how do they really know what they're doing works? They don't know. And so, they just got to take the opinion of the patients, and patients aren't doctors, so they don't really know what to explain. And so I'd gone to medical school, and I had learned when I was in the Far East this Prolopuncture. And so it was perfect for cutting tears. I wish I would have known I had a tear before the operation, because I had a hole now where I had a tear. So I started doing the Prolo to myself, and after 10 treatments, I was as good as new after 6 months. And a lot of times you'll go to a place that does Prolo, and they'll use different types of dextrose. They'll use 5%, 25%. They might only do 1 or 2 treatments. And see, the thing is I had to fix myself, so I know the protocol to use. And I was kind of upset. I was like, God, why are you putting me in a situation like this? But he actually put me in a situation that I fixed myself, and now I've helped thousands of people. In fact, I have an Amish following here locally, and I've seen over 4,000 Amish in the last 20 years. And with the Amish, they don't have electricity, so they don't have TV or radios, so everything's word of mouth with them. And I don't think I would have seen that many Amish if it didn't work, because bad news travels farther than good news.
Absolutely it does. What's the difference between prolopuncture and prolotherapy?
Okay, so once again, prolopuncture, we're using the dextrose and the B12 in the acupuncture spots, which are exactly where typically the injuries are, and the exact ways to get into the different joints. Okay, now prolotherapy, there's all different types of prolotherapy. They might not use B12, they might only use 5% dextrose, 25% dextrose. They might do a treatment, every month, maybe only do 3 or 4 treatments. So you got to be really careful when people say they know what they're doing with Prolo. I actually have before and after MRIs to show you exactly how it works and what, and because the testimonial from a patient, you really can't take their opinion, because placebo's 50%. So a lot of people think they're better, but they're not. And I've actually had a lot of people who did Prolo somewhere else, and they came to me, and it worked for them. So you really want to make sure when you go see a doctor, if he's got proof of what he's doing. And x-rays just don't show soft tissue. So if he shows you an x-ray and tells you something, it's not going to show soft tissue. You need to have an MRI, and like I said, you need to have before and after MRIs, and they got to at least be 6 months to a year, because anyone's going to feel better 2 weeks after their treatment if they get an MRI then. So
True. Okay, what can we expect from a course of prolopuncture?
Okay, so a course of Prolo is 10 to 12 treatments. we actually do 10 treatments first. And so you can do it twice a week, and if you do it twice a week, you kind of want to split the week up, like Monday, Thursday, or Tuesday, Friday, and then, but you know, we need at least a day in between. And so you come in, I give you some lidocaine cream so you can put that on wherever I'm going to put the shot so you don't feel the shot. We do the shot, and then I actually put some lidocaine in the shot because it'll numb it up for 30 minutes so you can get home and start to ice it, because having Prolo done is like having a second or third degree blister, ripping that blister off and pouring alcohol in it. It doesn't feel really good, but the lidocaine will hide it. And so what happens is you got 30 minutes to get home, and you need to start icing it because it will start to blow up. And now it's very specific how you have to ice it. You want to ice it 20 minutes on, 30 minutes off. You want to do this 3 to 5 times. Usually start out with 3, and as we go along, you'll probably want to go up to 5 because there'll be more tissue to irritate. So what happens is you go home, you ice it for 20 minutes, and then you got to let it warm back up, because the ice is going to make everything stagnant. It's going to make your blood congeal like jello. It's going to be blood stagnation, which is a bruise. So when it warms back up, then it'll move some of that stuff out, but then we have to ice it down. So it's actually like a pumping action by keeping the ice on 20 minutes and off for 30 minutes. And like I said, you do that 3 to 5 times. And the next day, you shouldn't feel anything if you've done it right. Now, if you didn't do it right, you want to use heat after 24 hours. You don't want to use cold anymore, because like I said, that will make things stagnant. And we actually give you these things called copper fit that actually help move the energy in the blood. So when you're going through the treatments, you're not going to have anything feel painful or stagnant.
Okay, so obviously swelling is a side effect. Is there anything else, like what is the downtime?
So this is actually, it's going to be 6 months that you want to be careful. The treatment takes anywhere from 10 to 15 minutes, but then after the 10 treatments, we start doing rehab, and we have what we call a vibration machine. You'll stand on that, because let's say if you have a bad hip or a bad knee, if you move that knee or hip, it's going to irritate it. Well, when you stand on this vibration machine, it vibrates and it makes your muscles contract without having to move your knee or your hip. And they say standing on it for 15 minutes is equivalent to working out for an hour. Now, if it's a shoulder, I give you like a pulley system that you'll be using, and we teach how that is. But I tell people, you know, you don't want to lift anything over 10 pounds your first 6 months and over 20 pounds your first year. And let's just say you were like a professional athlete. You would be done for the season, and they pay these people millions of dollars to be on the fields, and when they're not on the field, they have to pay someone else the money plus them. So they're trying to push these people out as fast as they can. And if these athletes aren't getting better in 6 months, you know, who are we to think we're going to get better in 6 months? So it's going to, you know, over the 6 months, the tissue will continue to grow, and you'll be building the muscle around it to keep that joint strong.
Okay, we often get asked about stem cell. Can you explain that procedure?
Sure. So stem cell is only, I think, 15 to 20 years old. It actually was outlawed at one point in time in the United States. But what stem cell does is it replicates wherever you get the stem cell. And so what it's really meant for is, let's say you have a bad heart. They can take a stem cell from your heart, they can grow the heart in the laboratory, and it's going to fit you perfectly because it was made out of your stem cell. Now, it's kind of funny how when they first started, they couldn't get the blood flow from the new organ to the body. So they actually took dextrose and they blew it up like cotton candy because it's like sugar. So it was like little capillaries that helped that out. But so stem cell, they actually get the stem cells from you. They used to get it from abortion clinics, and that's why it was outlawed. But now they get it from you. But the thing is they get it from your soft tissue. And you need fibrous tissue to mend tears. So it's, you know, when you cut yourself, you have your skin and then you have that fibrous tissue. It'd be like the soft tissue mending the soft tissue. That doesn't work. You need fibrous tissue, and I don't think you really even can get stem cells from fibrous tissue. So, you know, stem cell definitely has its merit, but once again, it's only 15 to 20 years old, and they've been doing this Prolo in China since I think the 30s is when dextrose came out. So that's almost like 80 some years they've been doing it, and so we know the long-term effects. You know, we're still guinea pigs to this stem cell stuff. So I know one thing, I don't want to be a guinea pig.
No, I don't either. Well, that's a lot of information today. Thank you so much. I think you've cleared up some questions that we get asked quite a bit. So if modern medicine